Okay, hi, my name is Charu Kaushik. I am the scientific director of the CIHR Institute of Infection and Immunity. I'm also a professor in medicine at McMaster University. I'm an HIV researcher. I've done that research. I'm an immunologist by training, so I've done the immunology of HIV and other viral infections, and I have a disciplinary program at McMaster University for past 25 years. Uh, Within this capacity, I've done a lot of work with community-based research organizations. In particular, we focus on reasons why HIV and other sexually transmitted viral infections are disproportionately higher in women. So, within that context, we worked a lot in women's reproductive health and particularly Black women's reproductive health because HIV infection rates are particularly high in Black women. And as a CIHR scientific director, I am responsible for making decisions around research investments in areas related to infection and immunity for CIHR nationally and internationally.
Bonjour, moi je m'appelle Kate Fröhlich, je suis la directrice scientifique de l'Institut de la santé publique et des populations. Je suis aussi professeure titulaire à l'École de santé publique à l'Université de Montréal. Dans le département de médecine sociale et préventive, ma spécialisation, c'est la promotion de la santé. Ça fait 30 ans que je mène un programme de recherche sur les inéquités en santé chez les jeunes en contexte urbain. Et à l'Institut aux IRSC où je travaille, mon mandat, c'est de promouvoir la santé publique et la santé des populations. Et qu'est-ce qu'on veut dire par la santé des populations? Bien, c'est ce qui fait que certaines populations sont plus en santé que d'autres. Donc, inévitablement, c'est la question des inéquités en santé qui est vraiment un thème de base pour mon mandat. L'importance de la journée aujourd'hui était vraiment de regarder et discuter les inéquités qui ont surgi pendant la pandémie de COVID-19 chez les populations noires, autant du côté morbidité et mortalité, mais aussi de comprendre du côté de la recherche qu'on peut faire mieux. Il y a un rapport Walport qui est sorti suite à COVID-19 qui a souligné ce qui était manqué côté recherche, côté résultats sur la question des inéquités par rapport à la COVID-19, exposition à la COVID-19, vaccination, morbidité et mortalité, mais aussi sur une note plus optimiste, qu'il y a, et j'espère qu'il y aura plus de recherche sur les réponses qui ont été données par les populations noires et autochtones pour survenir à la COVID-19 pendant les communautés qui ont offert des services, qui ont s'assuré que les gens soient vaccinés et qui ont rempli vraiment les trous que la santé publique n'était pas capable de fournir à l'époque. Les trous, ben, entre autres, il y a la vaccination. Maybe I'll switch into English so that Charu can follow. So some of the holes that Black communities and Indigenous communities filled during COVID-19 was to try to reduce the distrust in the public health services and get people to go to clinic to get vaccinated, to help when people couldn't get out of their homes to get food. So making food and other services more accessible. We know that many, for instance, Indigenous communities, on-reserve communities, organized to keep the rates down because they took public health into their own hands and ensured that the rates were low. So there was an important, and a lot of the work that has come out of the Black community in Toronto and Indigenous communities on reserve around the resilience that was shown at the time and the community organizing that filled in those gaps.
Yeah, so I'll just add that I wanted to thank you for the opportunity to participate in this panel because I was very keen to participate in this panel because during COVID and personally in my own work for 25 years, This is an area that has been really under-investigated, not enough attention has been paid. And as we know that during COVID, it was clear that as a country and globally, we wouldn't be able to beat the pandemic until everybody had equitable health outcomes. So clearly, this is an important area that some of us have known for a long time, but certainly COVID has shone a light on this so that there's more attention being paid to this area. And at CIHR, combined with all the other social events that were happening around the COVID-19, the focus is now on making sure that what we have learned, the lessons that we have learned through COVID-19, we actually build on that. And there is a whole series of work, research investments, science policy that is actually being focused around to make sure that underrepresented populations in Canada, equity deserving populations such as Black Canadians, Indigenous health or Indigenous populations, there's a focus on making sure that they have equitable health outcomes. And we know that not only these areas of research, but who does this research is equally important. So there is a particular focus to make sure that we are bringing and building capacity to do research by these communities, because we know that for these communities, we can only go as far as the trust goes, and the trust building happens best when we build capacity within these communities. So it's really important for us to be focusing on this, and that's why we are very happy to be here and talk about these topics.